Hello and welcome to Tech Talk. My name is Jabulani Tulanukumali, one and only JTK. And right now we are at the Parirenyatwa group of hospitals, and we are here to talk to one of the expertise in terms of the technological developments right here at Parirenyatwa Hospital. And we are going to talk to one of the HODs right here in pediatric radiotherapy, that is Dr. Mutizira. But before we do that, let's get into history and trivia.
Radiotherapy, RT, also known as radiation therapy, is a treatment modality based on the use of high-energy lasers or radioactive substance to damage tumor cells and halt the growth of division. RT, used alone or in isolation with different treatments, has been an effective tool for treating cancer for more than 100 years. Also today, it is an important therapeutic tool for the treatment of different kinds of cancers. It is estimated that about 2/3 of all cancer patients will receive RT as a unique treatment or as part of more complex therapeutic protocol. Before the advent of ionizing particle beams, medicine had few options for treating diseases, both malignant and benign in nature. The scenario rapidly changed after the discovery of X-rays in 1895 by Wilhelm Conrad Röntgen. The scenario rapidly changed after the discovery of X-rays in 1859 by Wilhelm Conrad Röntgen. Also, before understanding the physical properties of X-rays and their biological effects, 1 year later, their discovery, X-rays were used by Emil Harman Grebel to treat patients with breast cancer. In the same year, Antony Henrik Becquerel started to study the phenomenon of radioactivity and to research natural sources of radiation. In 1898, Maria Sklodowska-Curie and her husband Pierre Curie discovered the radium as a source of radiation. Only 3 years later, Becquerel and Curie reported on the physiologic effects of radium rays. By the first year of the new century, an increased number of studies reported the use of X-rays and radium in medicine. Skin cancer were the most frequent treated, even because of the low penetration in the tissue of radiation. In the 1910s, College developed a new device able to emit high-energy X-rays to treat deeper cancers. Another important scientific progress was achieved in 1928 when an International Commission on the Radiological Protection (ICRP) was created to address the questions of radio protection. Zimbabwe is one of the countries where radiotherapy is becoming a recognized medical discipline, and radiologist associations are being founded, as well as new studies confirming the effects of RT in improving survival of patients with the different types of cancers. Innovative devices with a computerized control in the medical practice. That was history and trivia. Stay tuned.
Welcome back. So as we said before, we are going to speak to one of the HODs in pediatric radiotherapists. So let's go and talk to Dr. Mutizira. Follow me through, let's go talk to her. Hello, this is the second segment of Tech Talk, and we are here with Dr. Mutizira. As we said before, we are going to talk to her, and she's going to explain to us about radiotherapy and what it is all about and what benefit it has to the people in and around Zimbabwe, so that you can get full information and know how and what you need to do when you're faced with a situation that needs attention of the radiotherapy. So I want to welcome Dr. Mutizira to the show. Welcome, doctor.
Thank you so much.
It's beautiful. Wonderful to have you. And I can see you look very nice.
Thank you so much.
So Dr. Mutizira,
yes.
We want you to explain to us, what is radiotherapy?
Radiotherapy is a word made up of two words basically. Radio from radiation and therapy for treatment. So radiotherapy is basically treatment using radiation. And in most cases, we use X-rays to treat various conditions, mostly cancers, but we also treat some non-cancerous conditions using radiotherapy. So treatment with radiotherapy is painless. You can't feel it, you can't touch it, you can't see it, it doesn't burn. I'm saying this to dispel the myth that is out there. So most patients think that when a doctor recommends radiotherapy, they're going to be burnt in some way. And most people in Shona will refer to radiotherapy as kupiswa. So radiotherapy, akusikupisa, it doesn't burn, it doesn't zap, there is no electric current that you feel as you it's totally painless.
Oh, beautiful. Yeah, it's true that you have to outline because there is no pain in it. Because honestly, I already thought radiotherapy has to do something with lasers, and it's something that people need to be well taught. So you mentioned that you also treat other illnesses apart from cancer. Can you happen to mention like a few or a couple so people can better understand?
All right. So a few of the other conditions that we treat using radiation that are non-cancerous include keloids. So sometimes patients with keloids will have surgery, then immediately after surgery, they come for a few sessions of radiotherapy to lower the risk of the keloids recurring. We also treat other benign or non-cancerous conditions like arteriovenous malformations with radiotherapy, for example.
Okay, yeah, big words there. What is arteriovenous malformations you would like to explain to the people? I know I'm going a bit too deep, but we need people to understand for the benefits of those that really do not understand what it is.
It's just an abnormal connection happening between the arteries
and the veins. All right, that's beautiful. So could you kindly explain to us how we go through the whole process of treating with radiotherapy?
Okay, so radiotherapy is a process. If a patient is coming for radiotherapy, firstly, we want for them to prepare for this session depending on what region of the body we are treating. You know, when we are giving radiotherapy, we target a particular region of the body which is affected by the cancer. So firstly, before they come for the actual treatment, they go through what is called simulation. This is a process where we take images whilst the patient is in their treatment position. And then after we have done the simulation, the images we've collected are then sent to a computer which we use to do what is called virtual treatment planning. So basically what we are doing here is mapping out our target region. So the area that is affected by the cancer, which we want to target with our radiation, we map that out. Then we also map out the organs that are not affected by the cancer, but that are in close proximity to the area that we want to target with our radiation. As you know, when we're giving radiotherapy, the X-rays pass through the body to reach to the area that we want to treat. And in that process, the X-rays pass through some normal structures that have nothing to do with the cancer. So we want to map out the normal structures that are close to the cancer, but that we can't avoid. The reason we do all of this is so that we can then calculate the dose that our target region is getting, the dose which the area affected by the cancer is getting, and also so that we can calculate how much these normal organs that are not affected by the cancer are getting, because we do not want to give more radiation to the normal organs than they can handle. So we need to track that and to calculate it before we give the treatment. So after the mapping process, we then call in the patient for treatment. But before we give the treatment, we want to verify, to make sure that what we've done in our computer and the work that we've done virtually, the treatment plan that we have created virtually is replicated on the patient. So the patient will come in for a session where we will then align or make them lie in that treatment position they were in when we simulated, and then we want to match our
treatment.
The images that we used for planning with the current images that we take when the patient is lying in their treatment position. When we are happy that these two have aligned, then we start our treatment.
Oh, beautiful. So there's a
Yes.
virtual section first.
Yes.
And then the patient comes in and is done with his present.
Yes.
Oh, that's
So
beautiful.
that whole process can take up to a week. So you'll notice that if a patient has been scheduled for radiotherapy, from the time they're simulated to the time they start the actual sessions, it may take about a week,
Oh.
unless it's an emergency.
Oh, that's beautiful.
Yes.
So, doctor, I want to ask, with the rate and the amount of people that are having cancer in and around Zimbabwe, are the machineries adequate enough to be able to facilitate and also to handle each and every individual that is suffering from these diseases?
Right, so as you know, we've had challenges with our machines over the past few years. We currently have 5 linear accelerators in government. Linear accelerators are what people on social media call the cancer machines.
Okay.
Yes, so, and we are standing in front of one of
One of
those
them.
linear accelerators. So we have 5 in the country, 3 in Harare at Parirenyatwa Hospital, and 2 are in Blawayo at Mpilo Hospital. So thankfully, our 3 machines at Pari are now up and running. For the past few months, we had 1 machine running and the other 2 were being fixed. But as of last week, all 3 machines are now up and running, and our engineers are now looking into fixing the machines at Mpilo Hospital. So we look forward to having all 5 government machines working in the next few months.
Oh, that's beautiful.
Yes.
So these machines are just there to scan out what you have and identify, and then you are given treatment afterwards, or they also administer the dosage, as you said, of treatment and giving the treatment as well.
The linear accelerators are used to treat. For the scanning process that we do before treatment, we have a CT scanner, a CT simulator. I will show you when we do our tours here in the department. So we use a CT simulator for scanning, and then the linear accelerators for treatment.
For treatment.
Yes.
So how successful have you been in any of your treatments, like in the past few days, years, months, I don't know, how so forth?
Right, so we've been treating a large number of patients. Since our first machine went up in May, we have delivered more than 3,000 radiotherapy sessions to date.
Wow.
And we look forward to an even higher number now that all our machines at Parirenyatwa are up and running. In terms of success rate for cancer control, still a big challenge for our country because most patients present very late. Most of our patients are presenting with either stage 3 or stage 4 disease, which is very advanced cancer and has lower chances of cure. So we would want our patients to present much earlier so that we can improve our treatment outcomes.
Oh, that's beautiful. So for the purposes of those who just are joining out or tuning in right here on Tech Talk, we want people to be able to come early for treatment. As you said before, it's actually a challenge because people are coming in late. Maybe stage 4, I don't know which other stages come after that. So we want people to be alert in the earlier stages. So are there any other things that you can help with, or maybe people can have identifications of those few things and they would know that they need to come in for a CT scan and be administered to have the right treatment?
Right, so so far, there are a few cancers that we can screen for. By screening, I mean we can actually do tests to try and pick these cancers in their very early stages, in the precancerous stage. So when we talk about screening, we are saying the people out there who are well, who are fit and fit into the screening categories for the various cancers should go and get the screening tests. For example, there are screening tests available for breast cancer. This is Breast Cancer Awareness Month. And the main screening test for breast cancer is what is called a screening mammogram. So this is an X-ray of the breast that is recommended for women who are aged between 40 and 70 years of age and should be done ideally at least once every year. This helps to pick breast lumps before one can actually feel them with their hands. So we encourage every woman to go and get screened for breast cancer. You don't have to wait until you feel a lump, because we are saying screening is a test done when you do not have any symptoms. So before you feel any symptoms, you must go and get assessed. And for breast cancer, we are saying mammograms need to be done at least once every year. There are also screening tests available for cervical cancer, and these include pap smear, VIAC, and now also the HPV DNA testing that is available to women aged 21 years and above, or women who are sexually active. We encourage women who've been sexually active for 3 years or more to
Come for screening.
or those aged 21 years and above,
Whichever age that resonates. Right? So there's certain women that say, we want to clear out some of the things that have been said in the street. As you said before, people have been talking about radiation as something that you get burned and stuff like that. And there's certain women that have been taking it to a notch that if you go for breast cancer screening, some doctors would start to feel my breast, and they're not comfortable with such stuff. So we want to know if there are any other machineries that do not resonate to that point of doing things. We know it's all about education and it's all about getting healthy. There's certain things that we can't run away from, but we also want to know if there are any other ways that are different from that type of treatment in terms of breasts for women.
Right. So unfortunately, when we are looking at the breast, we can't look for cancer without touching the breast. We have to. Whether you are doing the breast self-examination, which one is encouraged to do on their own at least once a month, in the first week of their menses. They pick a day and they stick to that day. And women are encouraged to examine their breasts at least once a month, but it involves touching the breast.
Okay.
Then if you're going for a clinical breast exam, again, a doctor has to do that. The mammogram will also involve contact. So we can't really run away from it. But
okay.
I think the important thing to remember is that the disease that we are looking for when we are examining the breast has far-reaching effects if it's picked late. So we encourage our women to come for these tests.
No, true. Yes. Could you kindly educate women on how they can do the self-test that you just mentioned? Like, how do they do it, like on their own, and how do they identify that they have these breast cancer?
Right. So with breast self-examination, this is an exercise which women are encouraged to do so that they are familiar with their breasts. And when one becomes familiar with their breasts, it becomes easy to identify an abnormality early. So that's why we're saying every month during the first week of the menses, you pick a day and then you stick to that day. The reason we emphasize sticking to that specific day per month is because the breasts go through various changes throughout the month because of the fluctuations in the hormones that occur in women due to the menstrual cycle. So we want you to stick to a specific date when that you then familiarize your breast with.
So if you feel anything funny or anything different.
Right, so lumps, so these lumps that one may feel, it's usually isolated from that main lump that is there in the breast. So this could be lumps in the breast, lumps in the armpit, and sometimes just lumps right here above the neck.
The neck, okay.
Yes. So if you feel that, if there is an abnormal discharge from the breast, sometimes it may actually be bloody, blood discharge from the nipple. Also, nipple changes. By nipple changes, I mean sometimes the nipple may then be pointing differently from the way it normally does. So it may be pulled in, or it may be just pointing a different direction from what it normally does. Sometimes you may also notice some dimpling on the skin, and it may look like an orange peel appearance. So sometimes that may be a sign of underlying breast cancer. Then there may be some changes on the nipple where it looks like there's a rash or there's eczema. That may also be a sign of underlying breast cancer within that breast.
All right,
Yeah.
thank you. And seeing them getting a brief explanation into it, I also want to play with it a little bit. I'm playing. My name is, you heard the doctor right there. She was giving us an explanation on how the whole process of radiotherapy works and how the machinery works and how safe they are as well and how many people need to operate this, which is a big and heavy job for you. So come through and get yourself scanned for cancer and other diseases that might be in your body so you can get help and treatment at an early stage. So join us in the next segment as we go through the review and take a look at some of the machinery right there. So yes, we were talking to Dr. Mutizira, who was just explaining to us how the whole radiotherapy process works and how we should come through and get treatment. But right now I am standing in front of a linear accelerator and we have Mr. Edwin Munskayasango to explain to us how the whole system works. And so let's give him the floor to talk to us right here. Welcome to the show, Mr. Edwin.
Thank you very much.
All right,
I'm a physicist. Right now we are standing in front of a LINAC, which is the machine that we use to deliver the radiation that we use for treating the patient. So I'll just explain in brief how this machine works so that you can understand the role that this important machine plays.
Okay.
So basically our LINAC accelerator produces radiation and this machine can actually produce X-rays or electrons, which really constitute our treatment beam. And for the basic part, basically, we've got the couch. This is where the patient lies. And we've got this part of this machine here. Below it is where these beams come from. And again, maybe of interest is some of the readings which are given here. These ones, they are just showing you the size of the filter which are going to treat and also the orientation of the machine. I'll just show you some of the motion that this machine can actually produce. So as you can see, our machine is moving in this plane. So if the patient is lying on this couch here, you can adjust the angle at which this beam can come through to the patient. That you can actually go right round, is needed. And also this couch can actually go up and down. So I'm going to indicate here. You can also rotate at the angle. So what I'm holding here is what you call a pendant. It's one of the main control units for this machine. Of course, outside this room, we've got another control station where the radiographers can operate this machine remotely. It also is part of the key features of this machine is that we've got some patient positioning system in this room as well. I'm going to dim the light so that you can see properly. I think you can see clearly the green lights coming from walls. These are lasers which we use for ensuring that we position our patient as accurately as we can actually achieve. And from this side, I'm also showing that this light is actually visible here. This machine can actually project light. It shows you the field size and also to project what area that you want to treat. And also part of the second features of this machine is that this machine is got it's actually close to a banner. As you can see, this room it has got some thick walls. These walls are more than the walls that we find in the ordinary house. It's also part of the safety features.
Well, that's all we had for you on Tech Talk. Please join us on the next episode.